In this lesson, we will introduce principles of program design, as well as cover warm-ups and cool-downs. Comprehensive fitness programs integrate a number of exercise principles and components to effectively reach clientele goals. Remember, the needs analysis developed from testing and screening procedures provides most of the client-specific details needed for this process. Major principles of program design include exercise selection and order, training frequency, duration, intensity, and volume, warm-up and cool-down segment development, energy system manipulation, rest intervals and recovery periods, and periodization, or the development of building block training phases to ensure continual improvements. These program components will be covered in greater detail in the following lessons. Let's begin our review of program components by covering warm-ups. The fitness professional must understand that cold tissues limit range of motion, muscle activation patterns, metabolism, and force production, making warm-ups essential to performance. The major benefits of a warm-up include increased neural sensitivity and transmission speed, greater movement economy and range of motion, increased oxygen and blood delivery, increased enzymatic and metabolic activity, and heightened muscle temperature. There are multiple types of warm-ups. A general warm-up simply includes basic movements such as jogging, jumping rope, or cycling for 5 to 10 minutes for baseline preparation. A specific warm-up utilizes the actions and musculature to be used during activities that reflect the client's goal. For example, if the client wants to improve their bench press, light bench pressing and other chest activation activities would be used. A performance or sport-specific warm-up includes actions and neural patterns that can improve performance in a particular sport. This type can reach 15 to 20 minutes in duration, as it will usually include general movements, followed by a neural preparation phase. An example could include jumping rope for 3 minutes, followed by mobility drills, muscle activation drills, and finalizing with moderate intensity ballistics. And finally, a functional warm-up focuses on therapeutic actions, injury prevention, proprioception, and improved movement economy. There is usually an emphasis on working on problem areas, but the format can vary. Here we see an example. With this 4-phase warm-up, we have gross motor activation to start, followed by rotator cuff activities and then core activation work for the abdominal muscles and lower back. The activities chosen should always meet the client's specific needs. Let's finalize by covering the importance of a cool-down. We saw that warm-ups progressively prepare the body for activity. Now cool-downs function to bring the body back down to a resting homeostatic state. This should take place immediately after exercise and include low-intensity, rhythmic, large muscle group activities through a full range of motion. The benefits of a cool-down can include prevention of blood pooling, the maintenance of cardiac output, reduction of blood and muscle lactate as well as stress hormones, a reduced risk for cardiac irregularities, and improved overall recovery. Here we see an example of a cool-down segment. In this case, a short bout of dynamic stretches is followed by foam rolling and then static stretches. The first 2 phases keep the client moving and working on mobility before progressing to the stationary static stretches to finish. This concludes the lesson on the introductory principles of program design, warm-ups, and cool-downs. In this lesson, we will cover metabolic considerations for programming, as well as exercise program components. The fitness professional should recall the energy systems used during exercise, as covered in an earlier lesson. We have the phosphagen system for strength and power-related activities that lasts up to about 20 seconds. We have the glycolytic system for hypertrophy and anaerobic capacity-related work that lasts for up to about 90 seconds as the dominant energy source. And then we have aerobic metabolism, which begins to take over as the primary source after about 3 minutes. If training across the metabolic continuum in a single workout, programmatic order should reflect these energy systems and the relative intensity of activities performed. Maximal strength and power work should come first, followed by hypertrophy and/or anaerobic capacity work. And aerobic work should be performed at the end of the bout. This order of training metabolic systems is used to optimize adaptations. Neural work comes before muscular work, which comes before metabolic work, so no system is significantly pre-fatigued before challenging it. Let's progress by covering additional program components, including exercise selection and order, training frequency, duration, intensity, and volume, and rest as well as recovery periods. Exercise selection requires the trainer to match each activity in a program with a specific need or goal. Every exercise should have a purpose. The need for movement skill acquisition among new clients, as well as limitations or interests, should also be considered. Exercise order is often dictated by primary needs and limitations, but in general, we want to follow the order of operations just covered concerning the energy systems. More intense, difficult, and multi-joint exercises, such as a back squat, should come before less intense, simple, and single-joint exercises, such as a seated calf raise. A warm-up and mobility segment always comes first in the training session. Then phosphagen work precedes glycolytic work, which precedes aerobic work. Additionally, mobility work and a cool-down segment should be in the final phase of the session. Here is a specific example of exercise order. Notice how the phosphagen-based cross-joint lifts, such as the power clean and back squat, come first. After that, the loading, instability, number of joints involved, and difficulty of the movement gives the activities their respective places in the rest of the segment. Training frequency relates to the quantity of training sessions each week. The common frequency for health benefits is 3 times per week, while fitness or performance goals require greater frequencies. For example, bodybuilders often work out 6 times a week. In any case, if the frequency is too low for the goal, improvements will be inadequate. But with excess frequency, the risk for injury or the overtraining syndrome increases significantly. Training duration relates to the amount of time a client is exposed to training stresses. It is often measured by time under tension, as this will count only the work segments and not the rest periods. For example, a person can spend a full hour in the weight room and only experience a total of 12 to 15 minutes of actual muscular work. In general, the higher the intensity, the lower the possible duration of stress. Training intensity predicts adaptations more than any other program component. It will indicate possible training duration and frequency, as well as rest and recovery needs. 2 primary factors that determine an appropriate intensity are the client's physical aptitude and ability to perform the work safely, as well as the energy systems utilized. Training volume is a measure of work performed during an exercise bout. It includes the intensity and either the frequency or duration of movement. For weightlifting, it combines the sets, reps, and loads lifted. Finally, we have rest intervals and recovery periods. Rest intervals are the time periods between physical efforts or sets that influence energy system contribution, recruitment capacity, subsequent performance, and training adaptations. Training intensity and activity type dictate appropriate work-to-rest ratios. Aerobic training allows for 1:1 to 1:3 work-rest ratios, while anaerobic training requires work-rest ratios from 1:3 to 1:12. For example, during a set of back squat for 6 reps that takes about 20 seconds, the rest period may need to be 120 seconds, being a 1:6 work-rest ratio. Recovery periods are the duration of time in between exercise bouts. These periods allow for energy system replenishment and adaptations to occur. Inadequate recovery increases the risk for injury, illness, and overtraining. Excess recovery limits fitness improvements. This concludes the lesson on metabolic considerations and exercise program components. In this lesson, we will cover concepts related to the primary exercise principles, periodization, and program safety. The principles of specificity, overload, and progression should be recalled from an earlier lesson. The strategic interaction of these principles can create adaptation-specific stresses for effective goal attainment. The principle of specificity states that for a desired adaptation to occur in the body, program stresses must match the intended goal. This guides exercise selection and various other program components. The principle of overload dictates that training stresses must challenge a system over what it is currently accustomed to for improvements to occur. The principle of overload can be applied by manipulating various training components, such as intensity, duration, volume, frequency, rest intervals, and the exercises performed. Proper application of this principle allows the client to surpass or avoid training plateaus. The principle of progression dictates that stresses applied during training must be continually perceived as new for continued improvements to occur. The magnitude of progressions employed in a training program will be influenced by several factors, including training tenure, genetic potential, the client's current physical condition, nutrition, and recovery. Proper application of this principle, with the principle of overload, maintains client safety and optimizes goal attainment over time. Let's continue by touching on the concept of periodization. Periodization represents the concept that the body adapts more effectively when adaptations are applied using a building block approach. It reflects a logical method of organizing training into sequential phases and cyclical time periods. Specifically, it allows adaptation residuals to be strategically built upon each other for maximal performance gains over time. Desired adaptive responses associated with training are referred to as supercompensation. The supercompensation curve reflects a period of time when work capacity or performance will be acutely elevated. Periodization organizes training phases so that these supercompensation effects can build upon each other for enhanced outcomes. The trainer must understand how long training residuals and supercompensation lasts based on the goals being worked on. As seen here, the longevity of common training residuals varies greatly. Aerobic endurance and maximal strength gains last about 30 days. Anaerobic endurance improvements last about 18 days. Strength endurance improvements last about 15 days. And finally, maximal speed improvements only last about 5 days. The longevity of residual training effects will dictate how long training phases last, as well as the necessary frequency of training for optimized improvements. Let's finalize the lesson by covering concepts related to program safety. One of the exercise professional's most important jobs is to make sure all participants remain safe when engaged in supervised physical activity. Failure to follow proper protocols, which puts a client in danger, is considered professional negligence. There are a few key factors to consider when creating a safe training environment. First, the trainer must consider the client's current condition, which includes a number of variables such as hydration status, any mental distraction, illness, low blood sugar, or excess fatigue. Hydration status is a key concern, especially if working in hot or humid environments, as dehydration can lead to a number of issues, such as heat cramps, heat exhaustion, or even heat stroke. The trainer must also ensure to maintain a clear working space. For example, make sure there is nothing for the client to trip over during a circuit. Training equipment should also be checked to ensure it is working correctly, as faulty equipment can lead to major injuries. Finally, the trainer must properly supervise the client during all activities. Knowledge and application of proper spotting techniques is crucial during resistance training. This concludes the lesson on exercise program principles, periodization, and ensuring program safety. In this lesson, we will cover anaerobic training systems. Training systems are methods used to exploit different categories of stress to emphasize specific improvements in strength, power, hypertrophy, or metabolic efficiency. Popular training systems include the priority system, pyramids, supersets, contrast sets, complexes, drop sets, circuit training, lactate tolerance training, and negative sets. Let's take a quick look at each to enhance our ability to provide specific adaptations for clients in the weight room, starting with the priority system. This system is straightforward. The trainer simply has the client perform exercises for deficient muscle groups or health limitations at the beginning of each session to ensure they receive adequate attention at times of maximal energy availability. The areas of greatest need are given priority. This system is often used during the general fitness or preparation phase of training and is good for new or novice clients. Now, the pyramid system was originally used for bodybuilders for muscle hypertrophy, but included an amount of sets which may not be practical for personal training. Half pyramids are more practical and allow for increasing loads with decreasing reps over 3 to 5 sets, such as performing a lift for 10 reps at 135 pounds, 8 reps at 155 pounds, 6 reps at 175 pounds, and 5 reps using 185 pounds. The initial lighter sets prep the neuromuscular system for optimal performance during the later, heavier sets. This provides for a combined hypertrophy and strength stimulus. Continuing forward, we have supersets and trisets. A superset simply involves performing one set of an exercise immediately followed by a different exercise, with only transitional rest in between. This allows for greater total workloads per session and can serve various goals, depending on the types of exercises combined. If hypertrophy is the goal, both exercises should target the same muscle groups to stimulate maximal fiber recruitment, such as the bench press, supersetted with push-ups. If strength is the goal, opposing muscle groups, or lower and upper body exercises should be combined. This allows the prime movers and stabilizers used during the second lift to not be pre-fatigued by the first set. But if general fitness or simple caloric expenditure is the goal, numerous combinations can be employed based on practicality and the client's interests. Trisets simply involve adding a third exercise to the end of a superset. This additional workload necessitates added considerations for fatigue and stability. For example, utilizing 3 exercises that stress the same postural muscle groups or joint stabilizers may lead to fatigue-related compensation and consequent performance breakdown. For this reason, trisets for many clients often include a lower body, upper body, and trunk exercise. Advanced clients may be able to handle various other combination options. Sample trisets could include seated floor reaches, body squats, and side raises for a beginner client, step-ups, push-ups, and abdominal crunches for an intermediate client, and pull-ups, lunges, and bodyweight dips for an advanced client. Next, we have contrast sets and complexes. A contrast set involves first performing a set using a heavy strength-based lift in a controlled manner, immediately followed by a set of an exercise that replicates the same movement pattern using a light load but performed at a very high speed. Examples could include weighted back squat supersetted with jump squats, or the bench press supersetted with medicine ball chest passes. This system maximizes fast twitch fiber recruitment, improves power, and challenges stability. Complexes also combine a heavily loaded conditioning set followed by a plyometric or ballistic activity that employs the same muscle groups, such as a heavy back squat followed by a sprint. The major difference with a complex revolves around the potential rest periods used in between the two activities. They can vary greatly, ranging anywhere from 30 seconds to as long as 12 minutes. 3 to 5 minutes is the average. The object is to have the heavy initial lift properly prime the nerves and motor units used in the second action to maximize power output. In the back squat and sprint example given, the back squat is used prior to the sprint to enhance speed during the effort. Some actions need more rest than others before this moment of optimal power output capacity, or neural gain, occurs. For this reason, complexes are not another variation of supersets, as seen with contrast sets. Let's move forward by covering strip or drop sets as well as negative sets. Strip sets are used for hypertrophy and maximizing muscle recruitment rather than power production. 2 to 3 sets of the same exercise are performed in a row, with only the time it takes to drop or strip down the weight serving as transitional rest. Each set is performed for a designated number of repetitions or to volitional failure before the weight is lowered for the subsequent set. This system works well on selectorized machines or other modalities where the weight can be shifted quite rapidly, such as a rack of dumbbells. As seen here, strip sets are sometimes added to the end of pyramids to add an extra hypertrophy stimulus and maximize the workload performed. Negative sets were popularized by early strength athletes to maximize force output and help them potentially overcome plateaus. The system is based on the fact that muscles can produce more force during the eccentric phase of a movement than the concentric. For this reason, the eccentric phase is performed using 110 to 130% of maximum, followed by a spot-assisted concentric phase. It is clearly critical that a spotter is always present. This stress can certainly help to develop eccentric and overall strength, but this system may not be appropriate for many clients due to the risk-to-benefit ratio. However, it can be strategically used during bodyweight lifts, such as push-ups or pull-ups, to help develop functional strength. Let's finalize this lesson by covering circuit training and the lactate tolerance system. Circuit training is popular due to the potential for high caloric expenditure, tolerable resistance levels across the whole body, and relatively short workout durations. You can burn more calories in less time. Usually 12 to 15 exercises, often 1 to 2 for each major muscle group, are each performed for a predefined time period or repetition range in sequential fashion with only transitional rest between lifts. Slightly longer rest periods can be given to novice clients. The full circuit is often performed for a certain number of cycles, where increased rest periods are provided between full bouts. Anaerobic endurance and mild cardiovascular benefits can be obtained from this system. Finally, we have the lactate tolerance system, which could arguably be thought of as a variation of circuit training for advanced clients. Lactate tolerance is developed by using a group of exercises that must be all performed for a certain number of reps in the shortest time possible, with proper form. The duration and number of rest periods depend on the exerciser's ability to recover and tolerate discomfort. Comparisons with previous times to full completion can be used to further increase the intensity over time. An example could include having to perform 50 modified pull-ups, 80 bench push-ups, 80 stability ball leg curls, 40 medicine ball slams, and 60 air squats as fast as possible with the least amount of rest possible. This will clearly force lactate production through the roof and challenge one's tolerance to muscle acidity and glycolytic efficiency. This concludes the lesson on anaerobic training systems. In this lesson, we will address specific considerations for anaerobic training, as well as common injuries. We will begin by covering considerations such as concurrent training, age, gender, overtraining, and detraining. Concurrent training, or using both anaerobic and aerobic training activities in a single program, is common in personal training due to the large number of clients who seek services for weight loss. Now, if caloric expenditure is the only primary goal, there is little to consider concerning this strategy. However, if aerobic or anaerobic development is the client's primary concern, it should be understood that adaptations for the two types of training somewhat conflict with each other. Namely, trying to elicit significant concurrent improvements in aerobic fitness as well as hypertrophy, strength, or power promotes conflicting changes in the body. Concurrent training promotes differing adaptations in enzyme and hormone activity, muscle fiber activation patterns, and muscle physiology, such as mitochondrial and capillary density. So, if anaerobic benefits are the primary goal, weight lift first during each session, and obtain cardiovascular benefits afterward via intermittent short-interval conditioning drills. This can help facilitate recovery and limit the promotion of adaptations that limit anabolic changes. And if aerobic benefits are the primary goal, make sure to get adequate respective volume and use anaerobic resistance training in a complementary fashion to improve movement and metabolic economy. As a practical note, if working on simple caloric expenditure and weight loss, it is recommended to always lift first and then perform cardio afterward, so that each energy system is worked in the correct order to limit fatigue. Aerobic work first will limit weightlifting efforts, but not necessarily the reverse. Also, steady-state aerobic work after a lift can help liberate energy byproducts from muscle and improve recovery. Let's note a few considerations related to working with clients of varying ages. Older adults can make great use of structured exercise to limit the risk for disease and dysfunction. Loss of muscle mass with age, or sarcopenia, can greatly reduce function. Older adults show as much as 40% lower power output measures when compared to young adults. They also fatigue faster and lose mobility due to connective tissue changes. Furthermore, their risk for falls and consequent bone fractures increases with age-related losses in speed, flexibility, stability, and balance. Thankfully, appropriate weightlifting and power training is very useful for maintaining power output, muscular function, and independence. Power and strength training are critical as fast-twitch muscle fibers experience the greatest losses from sarcopenia. On the opposite end of the age spectrum, with children and adolescents, we find appropriate exercise to be just as important to development. Safe resistance training in the form of simulated play or otherwise has not been shown to stunt growth or cause any related issues. One must realize that many play activities place more stress on bone and connective tissues than moderate intensity weightlifting. So, bodyweight exercises using pushing, pulling, climbing, and ballistic activities in play-based programs are encouraged and well received. It should be noted that children do well using short burst activities rather than continuous work, and added consideration must be placed on the fact that they have short attention spans, as well as lower thermoregulatory capabilities. Let's continue by examining the impact of gender or sex on training. We find that the average adult female's maximal total body strength is about 40% less than the average male's. More specific to region, the upper body capacity of females is about 55% of males, while their lower body capacity is about 75% of males, on average. The lower values are primarily due to relatively lower quantities of lean mass, combined with the fact that men generally possess 10 to 15 times the level of active testosterone seen among females. There are variances to this pattern, of course, as some females demonstrate a greater propensity towards strength development and muscularity. These individuals tend to have higher than normal levels of testosterone and other anabolic hormones, as well as greater relative tolerance for resistance exercise. Let's finalize our review of training considerations by addressing overtraining and detraining. While most people do not get enough exercise, some exercise too much and too often. Excessive training can push the body to experience a cumulative overstress effect, called non-functional overreaching. This results in a short-term detriment to performance, which may take several days or a few weeks to restore. If overreaching is not managed with proper recovery and nutrition, it can result in the overtraining syndrome, which causes a severe reduction in performance due to hormonal, immunological, neurological, and psychological disturbances. Symptoms of the overtraining syndrome can include persistently stiff and sore muscles, persistent fatigue, and increased susceptibility to infections, colds, and headaches, nagging and somewhat chronic injuries, sleep disturbances, decreased concentration and restlessness, increased irritability and depression, an elevated resting heart rate, loss of appetite and weight loss, bowel movement changes, and hormonal consequences, such as the absence of menstruation. Clearly, if a client experiences true overtraining, the fitness professional was most likely negligent. On the other hand, not training enough after gaining specific adaptations results in detraining. We find that weightlifting adaptations tend to last longer than aerobic. Detraining effects after stopping a resistance training program can include a reduction in muscle mass and fiber size, increased body fat, reductions in anaerobic enzyme concentrations, loss of muscle strength, power, and endurance, and a reduction in neuromuscular efficiency. These losses become most pronounced after about 3 weeks. Now, detraining for aerobic improvements is rapid, with compromises to adaptations beginning to occur within 7 days. Detraining effects will include reductions in VO2 max, cardiac output, stroke volume, and mitochondrial, hemoglobin, and capillary densities. A key point to consider is that detraining effects can be minimized during periods of low training volume by increasing the training intensity during each bout. Let's finalize the lesson by reviewing a few select injuries associated with anaerobic training. The personal trainer should understand that the application of price can help various soft tissue injuries, and with most occurrences, the client must be referred to an appropriate medical professional for help. Treating injuries is not within the scope of practice for a personal trainer. In any case, price, or protection, rest, ice, compression, and elevation, can be recommended by the trainer following basic injuries. Ice is useful for limiting inflammation directly following an injury, and within a few days, heat application becomes more useful to expedite recovery. Compression and elevation can also help limit swelling or bleeding and should be self-implemented by the client as applicable. Two of the most common injuries the personal trainer will encounter include strains and sprains. Strains are the result of stretching or tearing of a muscle or tendon. Remember, tendons connect muscles to bones. They often occur when muscles are stretched beyond their limits, are forced to contract too strongly, or are overused. Sprains are the result of stretching or tearing of a ligament, which are tough bands of tissue that connect two bones together at a joint. They reduce joint stability and function and often cause immediate localized pain, swelling, and immobility. They also take longer to heal due to limited blood supply. So strains directly impact muscle tissue, while sprains impact joints. Common causes of both include lifting heavy objects, poor lifting mechanics, muscle imbalance, placement of deconditioned muscle groups under high stress, rapid changes of direction, lack of an adequate warm-up, and overstretching, such as a hamstring pull during sprinting. Lower back pain is also very common, with an estimated 90% of adults suffering from it in either an acute or chronic fashion during adulthood. It is caused by conditions that impact bones, nerves, muscles, vertebral discs, or tendons of the lumbar spine. Lower back pain is often caused by a combination of excess exercise stress, overuse, muscle imbalances, lack of flexibility, general deconditioning, and/or overstretched tissue. Exercise professionals can aid in the recovery of non-pathological lower back pain via appropriate stretching and strengthening based on the causative factors, such as hamstring or hip flexor tightness or poor strength balance across the trunk. This will often be guided by recommendations from a medical professional. Shoulder impingement syndrome is also relatively common, with its prevalence increasing in recent years, even among youth, due to poor technology postures. Constantly looking down at one's cell phone has negative repercussions for the shoulder over time. During shoulder impingement syndrome, the rotator cuff tendons contact the outer end of the shoulder blade where the clavicle attaches, known as the acromion. and the tendons become inflamed and swollen, allowing entrapment or impingement. Common causes of this syndrome can include repeated overhead movements, excessive pushing exercises without enough pulling exercises for shoulder joint and girdle balance, shoulder joint instability, improper lifting technique, rotator cuff and scapular stabilizer weakness, posterior capsule tightness, and postural distortions. The trainer should work with other professionals to help improve the client's posture as well as strength and flexibility balance in the shoulder girdle and upper body in general. Finally, let's touch on rhabdomyolysis, or rhabdo, which has also become more prevalent in recent years due to cultural excitement around extreme training programs. Rhabdo involves the breakdown and necrosis of skeletal muscle tissue and subsequent release into circulation. It is caused by excessively intense training using high volume with inadequate rest. Higher temperature environments and dehydration also increase risk. Rhabdo can have very serious consequences, including organ damage, cardiac arrhythmias, and even death. It requires immediate medical attention. This concludes the lesson on training considerations and common injuries. In this lesson, we will cover concepts related to cardiorespiratory fitness, specifically how to measure training intensities, the primary types of training employed, and related factors. As detailed in earlier lessons, cardiorespiratory fitness greatly influences lifespan and quality of life. It is dictated by VO2 max, or the maximal quantity of oxygen one can use to perform work. Aerobic exercise develops cardiorespiratory fitness and the efficiency of the heart, lungs, and vascular system. Numerous factors determine cardiorespiratory fitness, so an evaluation of a client's aerobic capacity is needed to ascertain their relative ability to use oxygen. Test selection is based on the client's proficiency, goals, and specific needs, as well as the exercise professional's knowledge and testing experience. Safety is paramount. Submaximal tests are far more common than graded exercise tests, or maximal tests. Submaximal tests are far more common than maximal tests in personal training settings due to safety and the specialized equipment required to implement maximal tests. Popular cardiovascular fitness assessments in personal training include step tests, walk or jog tests, run tests, and bike tests. Please refer to the assessment chapter for details on specific protocols. Step tests are easy to implement, require limited equipment, and can be used with various types of clients. They may overpredict fit clients, however, and can be unsuitable for very obese individuals. Walk or jog tests are also easy to implement, require limited equipment, and are a good choice for deconditioned or new exercisers. They also may overpredict fit individuals, however. Run tests are again easy to implement, but are viable for fit or conditioned clients only. Validity can be affected by client motivation, running economy, and experience in pacing for the distance used. Finally, bike tests are usable for many types of clients, but they are relatively difficult to implement as equipment and technical expertise are required. Once a client's VO2 max, or ability to utilize oxygen, has been assessed, heart rates should be used to determine training intensities. A heart rate training zone for each client should be obtained based on their goals and desired adaptations. This is a heart rate range relative to the individual's maximal heart rate, so the first step in obtaining this range is to estimate this value. Thankfully, this is quite an easy step. You can simply take 220 and subtract the client's age. There are also multi-factor formulas, which are much more complex, but can obtain more accurate values. These formulas consider factors such as age, obesity, smoking status, and other variables. These can be quite useful, but when the simple heart rate max formula of 220 minus age is combined with a heart rate reserve value, the need to use these advanced formulas becomes less relevant. In any case, using just a derived heart rate max value to estimate the best training intensities falls short of the level of service a personal trainer should provide, as it assumes all clients should train within the same ranges. The heart rate reserve method builds upon the obtained heart rate max value to provide a practically usable heart rate training zone based on goal and fitness level. It considers fitness level by incorporating the client's resting heart rate. Remember, lower heart rates indicate higher levels of cardiorespiratory fitness. As seen here, a trainer can take the heart rate max value for the client and subtract their resting heart rate to get a heart rate reserve. This heart rate reserve value can then be used to calculate the low and high end of a training zone with much greater accuracy. Please refer to the lesson notes for a full review of performing the calculation. Also, the 6 to 20 rate of perceived exertion scale can be used to further improve the accuracy of training intensities, especially among clients using medications that alter heart rate responses during exercise. Remember, this is a subjective perception of intensity, with the 6 to 20 values vaguely correlating with 60 to 200 beat per minute heart rates. An RPE of 14 or higher means the client is reaching training zones adequate for aerobic adaptations. Once the trainer has obtained a practical heart rate training zone for the client, they should then implement training intensities found to expedite adaptations. For deconditioned clients, we should implement workloads equal to 40 to 60% of VO2 max, or 50 to 60% of heart rate reserve, or 60 to 70% of heart rate max. For healthy clients, we should implement workloads equal to 60 to 80% of heart rate reserve or VO2 max, or 75 to 90% of heart rate max. Let's finalize this lesson by reviewing the different types of aerobic training and benefits obtained when comparing low and high intensity training. The two primary types of cardiovascular training include steady state and interval training. Steady state training requires the client to perform work at a set pace or intensity so that they maintain a steady heart rate. Their heart rate will not vary by more than 5 beats per minute, as oxygenated blood supply is meeting the demands of working cells and tissues. This type of training can be performed for longer periods and is useful for developing baseline cardiorespiratory fitness for newer clients. Interval training, on the other hand, takes advantage of variations in heart rate and resistance or speed. It is more effective for inducing greater cardiorespiratory fitness adaptations, as the body always adapts to the highest perceived stress. With this type of training, the client engages in intermittent bursts of higher intensity work interspersed with recovery periods closer to a steady state pace. This may be more useful within personal training, as long as the client can handle the stress, due to the greater potential for adaptations and caloric expenditure in a shorter period of time. Depending on the client's goals, needs, and limitations, the trainer may choose to focus on higher or lower intensity training. We find that higher intensities are linked with greater performance gains and caloric expenditure, but moderate and lower intensities are linked with increased overall health, disease prevention, and a lower risk for injury. A common myth trainers fall for related to aerobic training intensity surrounds the concept of a fat-burning zone, which indicates that training at lower intensities is optimal for burning more fat and is therefore more useful for weight management. The major problem with this misunderstanding is that yes, a high percentage of total calories comes from fat, but the total caloric expenditure is too low for significant weight loss, making the fat-burning zone better for those who are already lean and just want to burn extra calories, or for use during a long, slow distance training program. Training at the highest attainable workloads safe for the client will expedite the best results. For general health, the client needs to work on most days of the week for at least 30 minutes per day using low or moderate intensities. For fitness-related goals, the client needs to work 3 to 5 days per week for 30 to 90 minutes per day at moderate intensities. For endurance performance, the client will need to work 5 to 7 days per week for 45 to 90 minutes per day. Mostly high intensities are used, with moderate intensities employed when a slight degree of recovery is needed. This concludes the first lesson on cardiovascular training. In this lesson, we will continue our review of cardiovascular training concepts and strategies, including calculating energy expenditure and practical training systems. We find that energy expenditure of 200 to 400 kilocalories per day is needed for cardiorespiratory fitness improvements associated with health and disease prevention. More is needed for performance. The relationship between calories and aerobic work stems from the oxidation value of energy. About 5 kilocalories of energy is expended per liter of oxygen used during training. So, if we know the total quantity of oxygen used, we know the calories expended during any type of daily activity or workout. A common method for conveying the energy demands of work is the calculation of METs, or metabolic equivalents. METs represent the amount of work performed and oxygen used, or calories expended, compared to rest. 1 MET equals 3.5 milliliters of oxygen per kilogram of body weight per minute of work performed. When at rest, we expend 1 MET. Activities and training measured via METs are multiples of energy used at rest. For example, running on a treadmill at 10 METs equals 3.5, the value of rest, multiplied by 10, which would equal 35 milliliters per kilogram per minute. Estimating a client's VO2 max via proper assessment allows for the attainment of a MET max and MET training zones for use while training on machines that calculate METs and provide values on their user screen. Furthermore, if MET equivalents are known for daily activities, total daily caloric expenditure can even be estimated. Now, these are all advanced concepts and not required to provide appropriate services related to weight loss, but it does allow the trainer much greater accuracy in calculating calories and workloads. Please see your lesson notes for detailed instructions on calculating METs during exercise and using these values to estimate caloric expenditure. METs do tie in with a practical application in the gym without performing any calculation per se. It should be clear that using METs requires body weight as part of the equation. This means if a proportion of the client's body weight is taken out of the equation while working on cardiovascular machines, the calories presented on the user screen will be incorrect. So, common caloric pitfalls performed by clients can include leaning on a machine, which is common of bikes, stair climbers, and ellipticals, holding onto the guide rails of a machine, which is common on treadmills, and failing to keep up with the default RPMs or speeds prescribed for the workout. These actions can all alter the accuracy of estimated calories expended. This simple concept should be taught to the client to improve their outcomes. Let's finalize this lesson by covering a few common training systems for cardiovascular improvements. Aerobic exercise aimed at improving cardiorespiratory fitness can include numerous systems and forms. Key factors to consider are duration, intensity, frequency, and energy expended per session. Technically, any continuous rhythmic activity that uses large muscle groups can be included. Boredom becomes a factor for any long-duration activity performed on a frequent basis, so using different modes and systems becomes increasingly important over time to reduce staleness. Common training systems include lactate threshold or tempo training, cross-training, cardio circuits, and fartlek training. Lactate threshold or tempo training is most suitable for advanced clients. This system can be used for improvements in stamina and lactate tolerance. The client starts at a steady-state pace as close to their lactate threshold as can be maintained. Intermittently, their pace is increased in short bursts of 2 to 5 minutes above their lactate threshold before they are physiologically forced to slow back down to a recovery pace. These interval supralactate threshold bursts result in lactate accumulation, very high ventilation, and notable discomfort, but significantly help to optimize performance and VO2 max. Cross-training simply uses various modes to provide varying stimuli. Separate sessions or microcycles can include running, cycling, swimming, elliptical work, stair climbing, rowing, or other modes of exercise. Cross-training provides many benefits, such as reduced boredom, a reduced risk for injury, tolerance of increased training volumes due to the varying muscle groups used, improved recovery, and improved mental focus due to the varying stimuli. Cardio circuit training requires the client to engage in steady-state aerobic activity, such as bouts of jogging, with the performance of intermittent resistance training activities. A common example can be seen at one's local park that includes a fitness trail with various stations to perform calisthenics, such as pull-ups or push-ups along the way. This can be replicated in a gym, using anaerobic stations interspersed with short bouts of various types of cardiovascular training. This system is engaging for the client and serves to provide minimal anaerobic benefits as well. It is useful for overall caloric expenditure and metabolic enhancements. Finally, we have fartlek training. Fartlek is a Swedish term meaning speed play, so this system is a type of interval training that incorporates unstructured fluctuations of intensity, commonly seen in spinning classes. Outdoor fartlek courses include variances in speed, distances, and even surface angles, such as uphill, downhill, or even sand running, to reduce boredom and provide a variety of training stimuli. This concludes the second lesson on cardiovascular training. In this lesson, we will cover various cardiovascular training considerations, as well as common injuries during aerobic programs. Let's begin covering training considerations by addressing genetics, age, and sex. We find that routine aerobic exercise can increase an individual's VO2 max by 10 to 30%. Genetics accounts for up to 50% of the differences and improvements between clients. Individuals with the following tend to experience the greatest gains: larger stroke volumes, greater concentrations of type 1 fibers, greater mitochondria and capillary densities, higher myoglobin concentrations, and more efficient neural and metabolic pathways. As it relates to age, the personal trainer should understand that healthy sedentary adults experience a decline in their VO2 max by 1% per year after age 25. This means attaining a higher level of aerobic fitness during youth will help prevent an early onset of functional decline. Thankfully, sedentary older adults who engage in aerobic activity experience improvements similar to younger individuals at 10 to 20%, but it is much harder for them to reach higher levels of fitness. Physiological differences also account for the approximate 15% disparity seen between VO2 max measures when comparing adult men and women. Females in general tend to have smaller hearts, lower stroke volumes, lower hemoglobin concentrations, less muscle mass relative to size, and higher body fat values on average compared to men. The trainer should consider the impacts of genetics, age, and sex on prescribed training programs. Environmental factors such as heat, humidity, extreme cold, and altitude all impact training responses. Heat and humidity provide notable additional stress to the body during training. The human body attempts to cool itself off via 4 primary methods: radiation, convection, conduction, and evaporation. Radiation refers to heat loss into the surrounding air through the skin. Convection refers to heat loss via the movement of cooler air across the skin. Conduction refers to heat loss via direct contact with something colder than the body, such as water or a bench. And evaporation refers to heat loss via sweat evaporation, which is derived from blood plasma that pulls heat away from the body. Now, hot environments make it difficult for the body to lose heat via radiation, convection, and conduction. But hot and humid environments also limit evaporation via sweat. This type of environment provides the greatest risk for heat-related illnesses and severe dehydration. Thankfully, the body acclimates to the increased stress of training in the heat over time. Generally, it takes 7 to 12 exposures for physiological adaptations to occur. These can include an earlier onset of sweating, an increase in sweat production and blood plasma volume, a reduction in the sodium concentration of sweat, improvements in cutaneous blood flow, distributing more heat to the skin, and improved overall thermoregulatory function. Interestingly, on the other side of the temperature equation, exposure to extreme cold for prolonged periods can cause hypothermia. However, cooler environments are actually optimal for cardiovascular training. Finally, altitude impacts performance as the oxygen concentration in the air is lower. This forces higher respiratory and heart rates when compared to training at sea level. Again, the body does adapt by increasing red blood cell and hemoglobin concentrations over time. This adaptation can turn into a significant advantage when returning to sea level for further training or competition. Let's finalize our coverage of aerobic training considerations by reviewing recovery and detraining. As it relates to recovery, new exercisers can benefit from a day-on, day-off method or cross-training. 1 full day of rest every 7 to 9 days is usually acceptable for training individuals focusing on improved performance. Additionally, non-weight-bearing activities such as swimming or cycling can be integrated to limit eccentric stresses if muscle soreness or stiffness becomes an issue. Now, too much recovery results in detraining. The cessation of aerobic activity allows for detraining effects within just 2 weeks. The body experiences a rapid reduction in blood plasma and stroke volume, increased reliance on carbohydrates for fuel due to a drop in lipid metabolism enzymes, a decrease in insulin sensitivity, and reduced left ventricle mass back to pre-train levels. After 3 weeks, mitochondrial density and oxygen extraction losses also occur. To limit detraining during periods of low frequency and volume, the trainer must increase the intensity during each session. Let's finalize this lesson by covering overuse injuries from aerobic training. Common contributors to overuse injuries include initiating a training program too aggressively, previous injury, poor technique or an uneven gait, lack of flexibility, poor joint alignment or muscle imbalances, an abrupt increase in foot impact volume, improper footwear, and inadequate warm-up protocols. Some of the most common injuries clients will encounter include chondromalacia, plantar fasciitis, IT band syndrome, low back pain, and shin splints. Chondromalacia impacts the articular hyaline cartilage of the patella or kneecap, causing potentially debilitating joint pain. Improvements can be seen with knee stability training and strengthening of the vastus medialis. Therapies for non-severe cases can include rest, anti-inflammatory meds, and ice therapy. Plantar fasciitis is the most common cause of heel and foot pain. The plantar fascia that runs along the bottom of the foot is strained and inflamed. It can be caused by various factors such as tight calves, Achilles tendon issues, an abrupt increase in training volume, improper arch support, prolonged walking or running, and obesity. Remedies can include stretching the fascia and calves, myofascial release techniques, massage, orthotics or arch supports, and anti-inflammatory meds. IT band syndrome is common among runners. It accounts for about 10% of all running-related injuries. It involves injury to the ligament that runs along the lateral aspect of the hip and thigh and presents as lateral knee pain. This ligament can become inflamed via IT band, quadratus lumborum, or gluteus medius tightness, uneven gait caused by running on uneven surfaces, high total weekly mileage, quad, hamstring, or gluteal weakness, inadequate warm-up protocols, and increasing training distances too quickly. Remedies often include stretching, myofascial release, ice and heat therapy, and avoiding the activity that incited the initial pain. Low back pain is common among all populations. Common causes in response to aerobic training can include muscular imbalance, poor flexibility, poor movement biomechanics or posture, gait discrepancies, general deconditioning, and android obesity. Stretching of the back and hips, strengthening the abdominals, and heat therapy can be useful for non-severe cases. And finally, shin splints are a condition characterized by pain along the inner edge of the tibia. This injury can be caused by a variety of factors including overuse, sudden increases in training volume, running on uneven surfaces, lower extremity biomechanical abnormalities, such as a limb length discrepancy, improper footwear, and general overtraining. Shin splints are often treated using rest, massage, ice therapy, and stretching or strengthening of the lower leg. Longer warm-ups and improved footwear can be effective for some cases. This concludes the final lesson on cardiovascular training.